A new report from Ontario's patient ombudsman shows a steep jump in healthcare complaints, and CP24's Andrew Brennan joins us live from Hospital Row with more. And Andrew, this comes, amid hearing a lot of, burnout in the healthcare industry.
Well, we're hearing a lot of burnout in the healthcare system, Bakari. That's one thing. We'll also have to bear in mind that at this time, there's an estimated 2.2 million Ontarians that still don't have access to primary care. And that's one of the findings that you see in the Ombudsman's report. But how many people are trying to access care at an emergency room versus being able to go to a doctor because they just don't have the ability to be able to see one. And clinics have lineups too. They ultimately feel like the best way that they can get any care is to go to the emergency room. And some of the stories of people going to the ER are pretty harrowing. One particular person was coming because they thought they were having a heart attack. By the way, turns out they were, and they were in a lineup of about half a dozen other people seeking triage from a nurse, and all of them potentially suffering from heart attacks, according to the nurse who according to this person reporting to the Ombudsman in a complaint, that this nurse said they were by themselves, they had run a 12-hour shift, and all of these other people could also have heart attacks, so you need to wait your turn. They ended up traveling 100 kilometers away, and as I mentioned, they did have a heart attack. Now, very quickly, we do have a statement from the Health Minister Sylvia Jones's office saying that one patient complaint is one too many, and ultimately they want to look over this report so that they can see what to do, as we have 600,000 patient interactions in the healthcare system every day. But there's more stories to share, Bakari, and I know that we'll have a chance to be able to do that throughout the day. But a lot of what this comes down to is not an easy access to primary patient care, a dilapidated and strained emergency service, and not enough people to be able to give people the health care, the publicly funded health care that they deserve, according to this report. Back to you.
Okay, CP24's Andrew Brennan. Thank you, Andrew.